Hi, my name is Michael Peters. I'm a bariatric surgeon in Delaware. Many of my patients have asked me to make a video presentation for them about surgery, so I'd like to present my first video in a series on bariatric surgery or weight loss surgery and whether it's right for you. If you want to reach out to me for questions or opinions, I've included my contact information below on our website. And please, if you have any suggestions about future videos or content, I'd love to hear them. I'd like to produce more of these and make it a regular thing. So off we go on Is Bariatric Surgery Right for You? Bariatric surgery is any procedure on the stomach or intestines that causes calorie restriction, malabsorption, or an alteration in the digestive hormones so as to result in weight loss. In layman's terms, this means eating less, absorbing less, or manipulating a sensation of hunger. Okay, surgeons will give you different dates, but the first true weight loss surgeries were performed in about the 1950s. These operations were variations on stomach and intestinal surgeries. These were for ulcers and cancers where the surgeons noticed weight loss afterward, as well as the resolution of diabetes and high blood pressure and many other ailments associated with weight loss. Now, this is how bariatric surgery, as a separate discipline, began. Weight loss surgery and interventions in my practice today include diet and nutrition counseling, a variety of medications, gastric balloons, gastric banding, the gastric sleeve, gastric bypass, and the duodenal switch. Finally, revision surgeries are entertained when applicable. Currently, the gastric sleeve is the most common bariatric surgery. I've included a video to show you how it's performed.
Small incisions are created on the abdomen. Trocars, which serve as passageways for the surgical instruments, are placed into the incisions. Surgical instruments are passed through the trocars to access the abdominal cavity. The surgeon examines the abdomen using a laparoscope or video camera. The average human stomach can expand to hold around 1 to 1.5 liters of food. While in the stomach, food is combined with digestive enzymes to help break down the food into a more simple form so that it can be more easily digested and absorbed once in the small bowel. During a sleeve gastrectomy, a thin vertical sleeve is created by using a stapling device. This sleeve will typically hold between 50 to 150 milliliters, or is about the size of a banana. The excised portion of the stomach is removed. The newly created gastric sleeve is able to hold approximately 1/10 of what the stomach was able to hold before. This smaller stomach sleeve restricts the amount of food you can eat before feeling full. The bile and pancreatic fluids from the liver and pancreas mix with the food and allow it to be completely digested and absorbed in the bowel. There is no rerouting of the small bowel or post-operative adjustments necessary for the sleeve gastrectomy. As with all weight loss procedures, behavior modification and dietary compliance plays a critical part in determining the long-term success of the procedure.
So all of these interventions are designed to treat the disease of obesity. Obesity is defined as being more than 20% over your ideal body weight. Once this excess adipose tissue or fat forms, it's very likely to become a chronic condition. The adipose and the chemicals it secretes will worsen underlying medical conditions or hasten the development of new ones. The medical complications associated with obesity include stroke, cataracts, and pseudotumor. The cardiovascular system sees an early onset of diabetes and hypertension, and a multitude of cancers have been noted to occur in younger individuals and are more aggressive. Women in particular suffer significant cycle irregularity, difficulty in conceiving, and early menopause. Pulmonary disorders such as sleep apnea are extremely common, and finally, studies show that adult lifespan is shortened if obesity is not addressed early. So the question remains, is bariatric surgery right for you? As a patient, you must meet certain weight and health criteria. Simply being overweight does not qualify you for a surgical intervention. The risk may actually be greater than the intervention. However, nutritional counseling, weight loss medication, and even gastric balloons are available to smaller individuals. Whether you and your surgeon determine if surgery is necessary depends on your body mass index and the number of health issues you have pertaining to obesity. This is not a cosmetic procedure. As you can see near the bottom of the triangle, lower weight patients should consider lifestyle changes, gastric balloons, and medication therapy. Patients with a body mass index between 35 and 40 must have one or two other significant health issues. These determinations are made by your insurance company. Patients with a body mass index over 40 meet all surgical prerequisites. Patients are often required by their insurer to see a psychologist and nutritionist preoperatively, and your surgeon will determine whether you should be further evaluated or optimized by a heart doctor or lung specialist. Finally, the majority of our patients undergo endoscopic evaluation to determine if their anatomy is suitable for surgery before receiving clearance from their family doctor. With the visits to all these providers, I think the patients have a much greater appreciation for their health overall, and they are certainly physically optimized before undergoing surgery. A final benefit I've seen is that the occasional patient will have such success with the nutritional counseling that they'll no longer feel surgery is necessary. I think that this is great. Not every patient should need surgery or should have surgery, but all my patients would benefit from some education regarding nutrition and some degree of weight loss before intervening. As you can see, the success rate of weight loss treatments varies. A simple placebo or sugar pill will result in weight loss if the conditions are right. Diet and physical activity will typically result in a 10% body weight loss, but we see this is not usually sustainable. Drug therapy affords a modicum of success if the patient experiences no side effects and has excellent compliance. Studies show that patients who pursue more invasive procedures, such as gastric bypass or gastric sleeve, will often experience a greater than 50% excess body weight loss in the first year, with long-term results ranging in weight loss from 60 to 70% after 10 years. This is for all surgical procedures. Once you've completed all the preoperative education requirements and your family doctor has cleared you for surgery, your coordinator at the practice and you will pick a convenient date for surgery. Now, 2 weeks prior to surgery, you'll meet with your surgeon, have your preoperative blood work performed, and start your Robard diet plan. We found most patients lose 10 to 20 pounds in that 2 weeks prior to surgery, and they're actually at their healthiest just before undergoing the operation. Thank you for watching today, and I hope it was educational. Myself and all the surgeons at the Christiana Institute for Advanced Surgery look forward to meeting you and discussing any questions you may have. The next video in my series will be entitled Your Operation. I hope you find time to tune in again.